Thank you, Kelly, for joining us to review the sessions that you've had with Kimberly and I in the management of your wrist and your knee. So thank you very much for just being so open to providing us with feedback.
Of course, it's lovely to be here, and thank you both for having me and treating me. I appreciate you both putting the time.
Oh, it's been a pleasure.
So Kelly, what did you notice from our distance session? I know that's something that you might not be very familiar with, but did you notice some shifts and changes from me working on you from a distance?
Yes, so I went to see, I think, Rob's the next day after we had our session. And obviously having a distance session is completely different to having someone that's up and close and personal. So you obviously have like doubts, is it going to be a full-on session? Are you going to get the full extent of what it would be in person? But I did explain to Robs that it was quite crazy that you picked up things, and the way that we just work through things was just spot on. And I don't know, it felt like I was emotional during the session, but it almost felt like I had like a weight lifted off, and I was like almost like relieved. Yeah, it was just crazy. I can't even put it into words, but it was a very interesting session.
Wonderful. And then what has your experience been like working with Robyn?
So with Robyn, it's been very interesting as we've gone from doing hands-on therapy, exercise therapy, so all the ins and outs of the normal OT routine. And now that she's introduced, obviously, this and the tuning, it's just almost increased I don't know if it's like confidence in my wrist and how it feels to just have it there, knowing that it's working on it slowly, and it's a slow progress with me bringing in my part and Robyn doing the same. And it's just interesting to know that by going to a half an hour session with Rob's, I walk out and it's almost like I've done an everyday session of meditation, therapy. It's just wild.
Love that. Is there anything else that you want to share? Like, is there any changes in your wrist since our distance session at all?
Yeah, so it almost, I did experience, I spoke to Rob's, I think, earlier this year about my wrist feeling just a bit like it's foreign. So It feels like it stops. So it was like my shoulder, my elbow, and then it stops, and then it's like my wrist and hand. And it always felt like it was tight and restricted, as if it was getting hold and I can't have any movement. But since our session and the next day, it almost feels like there's like a flow. And that sounds weird, but like blood flow, or like the nerves and everything like flowing to one instead of just like stopping. And it almost feels like there's strength when there's not strength, but there's strength. And then I don't know, it's just crazy to go from not having like the mindset of being able to lift something or move it in a certain way, and now it's just without having to think, it's just happening naturally.
Cool.
It's incredible.
Are there any other? Go ahead.
Oh, sorry, Kimberly. No, I'm just saying it's incredible because of Kelly's history. So this has been an injury that's gone on for a little bit more than 2 years with multiple surgery. And we did very, very well with our traditional therapy before I even knew about energy medicine. And it was a lot of hard work as a therapist to mobilize her wrist and to get that motion and to release the scar and to flatten the scar. But as soon as we began energy medicine, I had to work a lot more with my mind, which is a little bit more tiring than my body. But it's amazing how you don't have to put in that physical input to get the result of range of motion. And Kelly, maybe you can explain, you have a little bit touched on it, but patients like to be touched. They like to feel that their wrist is being mobilized, and they like to have a massage, and they feel that that's therapy, and you know, this kind of work might just feel a bit abstract. Can you maybe just talk about it from having experienced both, in terms of what doubts someone would have, what concerns they might have?
Yeah, so it's an interesting question because obviously, like you've touched, we did the full-on hands-on traditional therapy, and when it comes to injuries, like you said, a lot of people are just automatically, let's go to physio, let's go to chiropractor or bio or someone that's gonna massage me or do the hands-on therapy. But when I walked into your offices this year, and it was a completely different way of you doing therapy, I wasn't skeptical as in, oh, this isn't going to work and I'm not going to have any results. But I was skeptical in the sense of, if you're not doing any physical work, how do you get results when you're not? It's obviously going to be stuck in my mind. I was like, okay. And the more that we worked with the energy healing, and every session that we were just open and we allowed the space to just, you know, welcome healing and positive energy, I think the more the results showed. So I think for people to go from wanting the touch because it's just normal, I think there's doubts as in, am I going to get the results when I go home? Am I going to feel better when I leave? And I think them having, oh, but you're not touching me or doing anything, but using a tuning fork, how's it going to fix my pain? But it's just crazy to actually go from both and see that, okay, you actually don't need to do that many sessions of physical touch, where we've been a short period now, this last surgery, and our results are much quicker with the range than the first time. So it's just crazy to see how the doubts are there, but they quickly just changed.
They fall away. And then so Kimberly, Kelly first experienced the biofield work with me before she experienced it with you. And I worked from the edge of her field with the intention of finding those moments in her life where there might have been some resistance in her biofield. And I was talking through the whole session with Kelly, so she heard me. Kelly, do you want to just maybe reflect on how you experienced that physically, and then we can move on to the session with Kimberly?
Yes, of course. So, Robs and I have obviously known each other for a few years, and we've now become friends, which is lovely. But there's obviously some things that Robs would never know. My friends, like some people, just never know things. And it almost felt like we're working through the session to fix all my aches and pains and my physical ailments. But at the same time, Robs was picking up emotional issues or triggers or things that I've been thinking. Like, for instance, if I'm not on the bed and she's doing the work, I'm thinking about, oh, if I'm doing this, and then she mentions it, and I'm like, this is just wild that I'm getting all the aspects of healing in one 30-minute session, an hour session, and it's just, you feel a physical, just like a wave of like warmth, and then it's just relaxed, like you're in ocean water.
Yeah, and it was interesting from my perspective to kind of also demarcate, like there was a definite line drawn when you were 18. Everything just seemed, you know, quite turbulent up to 18, and then the last 10 years was just like a dream for you. And then closer to where you are now, I could start to feel, you know, from when you had your injury, that must have felt quite freaky for you.
Yeah, it was crazy because I'm like, how are you mentioning all these parts of my life that it's just, like, pivotal parts, that it's just crazy to even think that you'd have any clue to mention the ages or what it would be.
Yeah, so let's hand over to Kimberly, because then you went into the distance session. What did you find, Kim?
I just remember working there was a lot of energy that shifted in the ancestral areas in the field, at the edge of the field, and then closer to the body. It just felt like a lot of energy was shifting there. And so that can be some genetic pre-patterning. Also, I kind of feel like when there's a lot shifting in the ancestral areas that, they're really showing up to really help in the healing journey. And I always love whenever that energy shifts so much, because then it's almost like all of the entire family starts to bet, whether it's parents or siblings, or if you had any kids, like everybody starts to benefit. You start to see, I remember when I started to see shifts in my siblings, and them, like things that I would normally see them get triggered, and then suddenly after I get worked on, I start to see them more and more coherent, more and more solid, more and more productive. And so that's when I was working on you, Kelly, seeing all of those like really powerful shifts in those more genetic edge of the field and in these ancestral rivers. I was like, wow, the family's really coming here to help support you in your healing. So
Yeah, okay.
So
Is
those
there
are the biggest
anything,
findings for me.
is there anything you want to ask Kimberly specifically about your timeline, or about anything that you feel led you to have these injuries that are predominantly on your left?
Yeah, actually, thanks, Rob. I didn't think of that, but so I guess I don't know if you'd be able to answer the question, but maybe you can give a little bit of a background. I am right-handed, but I do tend to do a lot of things with my left. But I right-handed, everything is majority right-handed. So when I got the injury on my left wrist, it was very strange because everyone said it should have been on my right because it's an overworked injury. So do you think because it's on my left, it has something to do with more than just an injury that happened? Or
Usually that's what it is. Like I had broken my right ankle right around my 18th birthday, which is when my dad had said, 18, you're on your own. So there was, and the right ankle is about feeling supported moving forward. So people are like, yeah, but you broke it working in a restaurant. And I was like, yeah, but there's also like an emotional aspect to it as well.
Yeah.
So with that left wrist, it can relate to, our ability to receive and feeling worthy of receiving and being flexible about receiving, not only just like money, but also thank yous and I love yous or compliments. Like when people are like, wow, I really love your tattoos, or I really love your shirt, and being like, oh, it's nothing, and kind of almost like throwing, that energy that people are trying to give to you, and not receiving that very well, or receiving feedback. If people are like, you really should try to work on this, and you're like, no, I don't have a problem with that. Trying to like any type of trying to receive, whether it's energetic or physical, can affect that left wrist.
Okay, that makes sense.
Yes.
It's very interesting when you put two and two together.
And also the re-injury. So to put it in perspective, Kelly was working on the ships. She left South Africa when she was 18. So interesting that you both had an 18-year kind of mark in your life where you were scared, whereas Kelly found freedom. And she went into the big wide world, and she was having a whale of a time. She didn't have to answer to anybody. She didn't have to check in with anybody. And then suddenly, yes, the injuries brought her back to South Africa. But in this time, she hasn't been able to confidently go back to working on the ships because of her wrist. So I think there's been a lot of hesitation. Can I go back? Will I be okay to go back? And then the knee injury, I think, is interesting for me. Kelly, just in terms of whether or not you actually want to go back, you know, or whether you need another excuse to stay longer.
Yeah, it sounds like that. It's exactly like that.
No, that's amazing. And then moving forward, I mean, in your mind, do you get to a point where you feel, okay, I feel quite healed? Or are you feeling like, no, I'm stuck still?
I think I feel stuck because I've always now got this thing in the back of my head that it's going to be a forever injury that's just going to pop up, or I'll be healed and then something else will happen, or yeah, I don't know. I'm just, I guess, worried that something's going to go wrong. Maybe it's a paranoia, but I guess it's just because of the first and second part. But yeah, I don't know.
I find it's important to be careful when we say always. So any kind of program that we're telling ourselves, well, I'm always thinking that this is going to be a forever program. So I would be like, in the past, I've been worried. So I try to catch myself and my friends whenever we use the word always or never. So being open to the idea, sometimes that little phrase can help you. Being open to the idea that you're healed fully and completely is a good program to kind of set in the brain. Yeah.
I think also what would probably be beneficial is maybe another 1 or 2 full body tunings where we can do in the practice and see if we can keep clearing that energy, because Kimberly, it doesn't just go in one session. It takes time. The body has to respond. Different moments, different emotions surface.
I will also say that the younger you are, the faster it can heal. You know, I've worked on people who are in their 60s and 70s, and they've got a lot more, traumas that they've been through that sometimes they've never even worked on, and they can be really rigid and like set in their way. It's always, it's been like this, or it's always been like this, and so they can be a lot more rigid in their thinking. So, being able to work on you when you're so young and still dynamic and flexible with your thoughts and beliefs, that, I think the younger that people are, and especially the more open-minded, that you can like start leaping and bounding with this work, really. And the, best thing is being able to go there, to these places. Some people are like, they like black that out. They don't even want to think about that, or like, no, I'm not going to talk about this part of my life. So, being able to be open and feel, comfortable enough to talk to Robyn or I about, what's going on in these ages as they come up, and like getting it out of the system. I think that can be really powerful. And especially on your legs. That's what, when your feet are strong and your knees are strong, then that's builds a foundation for the rest of the body. So I'm glad to hear that Robyn's not just working on your wrists, that she's also working on your knees, and maybe she'll also work on your feet and get them solid and planted on the ground.
Course, always.
So
we do lots of work on the full body, which is incredible.
And I think, Kimberly, what Kimberly's also referring to, which I do try and focus on as well a lot, is working energetically, bringing your feet into the ground so that you're feeling that you've got both feet on the ground, that you're stable, that you're not, just half in America on a ship somewhere, half in South Africa, that you can be either or, and it doesn't matter, because wherever you are, you're absolutely grounded. And I do feel when I am tuning you, that energy does definitely easily suck into the ground. And then a really good thing to do is to have a salt bath after the sessions. Especially we do put your wrist in salt water, But obviously it's nice to just fully immerse yourself, or going for a swim in a saltwater pool, just to be able to get all of that in. And then the other bit of work that I've been doing with you is when I start the sessions, just with all the electricity and energy in your head, just making you feel that you're also able to have a bird's eye view, that you're able to look from above, as Kimberly describes, the periscope that's able to connect. So if we clear that energy and give you that feeling of, being able to connect with that divine energy, then you're able to also trust your decisions a whole lot more. And then he also asked me, how's the body left at the end of a session? And I was explaining, doing that figure of 8 and closing off that energy and kind of releasing that energy as well, which we do so that you don't feel at a loose end.
Yeah, I consider the figure 8, I kind of nickname that stirring the soup. So you put all of this energy back into the body in certain places, and then when you start to do that figure 8, it just helps integrate that energy into the whole body. And so, you might put all this energy back into the knee, but that figure 8 really gets that energy flowing, into the head, or, more into the feet or into the hips. And then connecting, that your will with the divine will, I find that helps, another layer of connection, not just to the earth and above, but to the divine. And that is, really helpful and feels good for a lot of people.
Yeah, it does. It's almost like a meditation session, but you just feel like warm and at peace, like you've just been in a pool of water and you've been hugged, and now you out into the world.
I love that.
It's so beautiful. What's so lovely is that Kelly has been talking to the surgeon and giving this feedback and explaining. He does like raise his eyebrows at times. What do you mean? but I think that they are starting to be more open to this idea, and as more patients go back and give feedback, and it's so lovely for you to be able to do that, Kelly. So thank you, because it just raises awareness, and they might get that one patient where they think, you know what, this person's energy needs help. That's all they need to think.
Yes. I think it is a nice way, because it's one thing for them to just think, oh, she's going back to OT and cool, whatever. But the fact that I can go and tell them she's not touching my wrist and pushing me through aching sessions. This has all got to do with me laying on a bed, and she's doing energy work, and and it's just crazy to see that we came from 20 degrees each side to 70.
Yeah,
which is from. So I think it's going to be nice, and the more that we go as patients to go and tell our other doctors or our friends, more the other doctors can talk about it amongst themselves, and maybe spark a conversation for someone else to go, okay, cool, maybe you need to change a few things.
I worked on a person who was 82, and he had diabetic neuropathy in the bottom of his feet, and I used the crystal and the weighted fork all over the bottoms of his feet. I would go put his feet in salt water afterwards, and he told his doctor that he soaked his feet, and the doctor was like, what are you doing? I've been your doctor for how long, and I've never seen your feet look this amazing. And he told them that he put his feet in salt water, but was too embarrassed to tell his doctor that he was having tuning forks with crystals put on the bottom of his feet. But his doctor told all of his clients after that to start soaking their feet in salt water. So he did change
one thing,
the way, one thing. And I was like, well, good. At least the patients are getting their feet in salt water, helping to ground that energy. But it's, when people are too embarrassed to share, this kind of difference and healing, I think that's kind of funny. So I'm I'm really grateful to you for having the courage to tell your doctors that what's working for you.
Of course, I think it's important for them to know, so that not only people like you to continue your great work and you get more patients, but that doctors do step out of the comfort of, the normal traditional healing, and they come into the different healing that you guys are offering. Because, I mean, everyone's going to be skeptical of what they don't know. And until you try it and get results, they're never ever going to understand.
Beautiful. I think that's a great place to end.
That's wonderful. Well, thank you for sharing with your doctors.
Yeah. Thank you, Kelly. And thank you for being so open.
Thank you both.
We'll see.
Of course, thank you both for letting me join you in your course and your studies. It's been amazing from the both of you to have sessions. It's great. So thank you.